Oregon's budget shortfall is a wake-up call, but it's also an opportunity. It's going to force all of us to change our healthcare system to reduce costs one way or another. We can use this opportunity to make smart long-term changes that will reduce waste and inefficiency, cut costs, and improve quality for everyone. The cost of healthcare can no longer be allowed to grow at double-digit rates, because if it does, it will continue to rob resources from wages, from school funding, and from our common social infrastructure. For businesses, healthcare costs are like a giant leech, sucking productivity and investment out of the economy, out of businesses, and out of our pockets. The problem here is not how we pay for healthcare. The problem is what we're buying, and whether what we're buying can produce health at a cost we can afford. I've charged a group of stakeholders from all sectors of the healthcare and long-term care community, consumers, and bipartisan representation from the legislature to help build a plan to transform our healthcare system and the way care is organized and delivered. And I want to thank them for the long hours of work they put in and for their willingness to work together. Their plan addresses the following challenges. First, chronic conditions. We know that as much as 80% of the cost in our healthcare system comes from treating people with one or more chronic conditions like diabetes or congestive heart failure. Furthermore, we know that 10% of the population accounts for 70% of those costs, and some 40% of Oregon health plan costs are hospital-related. We have to start shifting our focus towards prevention and wellness to avoid whatever possible serious health problems there are and the costs associated with them, particularly hospitalization. And as a state, we need flexibility from the federal government to pay for the basic preventions we need. Let me give you an example. Suppose you're a 92-year-old woman with well-managed, stable congestive heart failure living in a small, unair-conditioned apartment. And there's a heat wave. And the increased temperature in the apartment over several days can put enough strain on your heart to put you into full-blown congestive heart failure. Under the current system, we won't know about you until you show up at the emergency room. Under a more rational system, a new community health worker would be checking on you on a regular basis to make sure you're not getting into trouble. Under the current system, Medicare will pay for the cost of your ambulance ride and $50,000 for your hospital stay to manage your condition. It won't pay for a $200 window air conditioner, which is all you need to stay in your home and out of the acute care system. Surely we can do better. The key here is better coordination of care, and that means patient-centered care, which integrates mental health, physical health, dental health, and long-term care services to be more patient-focused and provide better care at lower cost. There's already great work happening across our state that shows how focusing on prevention and better coordination of care keeps people healthier and lowers costs. Now we need to look at moving those best practices statewide. And finally, we need to reduce waste and inefficiency. We know that between 30 and 40% of the cost of healthcare can be attributed to inefficient, ineffective, or unnecessary care. By focusing on the right care in the right place at the right time, we can improve care and reduce costs. And we're also going to be setting up a health insurance exchange. Times are tough for small businesses, and we have to do everything we can to help keep employers competitive. And the growing cost of healthcare is a huge drag on competitiveness. Small business owners who are members of an exchange will be able to offer their employees the option to compare plans and find quality, affordable care and easy enrollment. These business owners will no longer have to act as insurance experts because the exchange will take care of that for them, along with tax credits to help pay for the coverage. And just as importantly, a strong exchange will hold participating health insurance companies accountable to standards for service, quality, and pricing. In conclusion, let me say that what we're putting before the legislature is a proposal to address the increased cost of health care by fundamentally changing the way health care is organized and delivered, to improve the health of our population at a lower cost while improving the patient experience in terms of clinical outcomes, patient safety, and patient satisfaction. Unlike the short-sighted decisions of other states that are considering dropping Medicaid recipients from coverage altogether, we're taking a different approach because there's nothing to gain and a lot to lose by stripping people of their insurance coverage only to have them show up in the emergency room where we end up treating their stroke in the hospital rather than managing the blood pressure at home and in the community.